I just wanted to show you what pace feeding is and how you can kind of keep it up. It is difficult. You will get the hang of it eventually, but it's mostly about him being able to control the flow, try and reduce some of that gulping and that air that's coming in, and help him to learn how to suck and use all of those muscles in the mouth. So again, you want to use kind of a bottle that has a good amount for baby to latch onto. You want to have him upright a little bit. And then what you want to do is kind of try and use the bottle to get him to open up. And I know that this is a really difficult thing to do with a lot of babies, but if you can kind of tickle it, what you want to see is that the mouth opens up really nice and wide, and you're actually going to latch the bottle on. So I have this little mouth puppet. Don't mind the props, but so basically what you want to see is like you do a little bit of a tickle of the lips and you want it to open. You almost want the bottom lip to actually plant. It's obviously going to be much smaller, but you want it to plant on there and latch on with the nipple pointed up towards the roof of the mouth. And that's actually going to be the best way to get the most effective latch and to also bring more of the nipple of the bottle into the mouth a little bit more so that the whole thing is being compressed. So when you're doing that, tickle, 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 and then you're going to bring the bottle in, and then once baby is actually latched on, you want to keep the bottle a little bit perpendicular, and then perpendicular, horizontal, sorry. And you basically want to just kind of slowly tip, put a little bit of milk in. He's going to be sucking and sucking and sucking. You want him to keep sucking, and you sort of just like tip the milk in and out a little bit, giving him time to slowly bring that in to really control the flow of it. There's no great big gulping that's happening, and it's actually compressing the part of the nipple on the bottle, and is by doing that and actually using the mouth muscles and sucking on it, it's compressing this, pushing the milk out. So he's actually having to be very actively using all of the jaw muscles during this type of feeding. So what it kind of looks like with the mouth is that baby is on there, they start feeding, and they're actually like, obviously the mouth isn't moving like that, but the tongue is going to be curled up around the bottle nipple, and it's going to be compressing up against the roof of the mouth, and that is what's going to be helping to kind of squish that milk out exactly the same way that it would be for breastfeeding. And then the suction, when he can hold the suction on there, that's what's going to keep the milk flow coming. So it's totally okay, and I know that it's nerve-wracking to have a bunch of air in there, but again, it's all about being able to kind of put a small amount of water in your mouth. Same as if you were going to take a drink, small amount of water, and then the air stays kind of in the top part of the mouth and goes out the nose. He'll do the exact same thing. It just needs to get the rhythm down. Again, the gulping is what actually makes babies super gassy, and they take a whole bunch of air in because it's just like gulp, 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 trying to get that down. So slowing the flow, tipping it up just a little bit at a time, helping it to kind of be a lot more of a controlled and slower feed, giving him lots of breaks, allowing him to decide when he's full, watching for him turning away his head and that type of thing. It takes some getting used to. It is a very difficult thing to do, but it can be very beneficial, especially with using the bottles that have really nice long nipples on it, so that they can get a good latch and actually start to pull that nipple in and suck on it and start to use all of the muscles in the mouth and the tongue. I hope this helps. Let me know if you have any questions. So as you can see in this video, the bottle is being held slightly perpendicular to the baby. So baby is sitting upright. The bottle is not, or the nipple of the bottle is not completely filled. She's tipping it back and forth to be able to have him have a little more control over the flow. This will get a little bit of air into the mouth, but what ends up happening because it is not a fast flow is that the air can actually come out through the nose, just as if you were drinking a glass of water. So when she keeps just tipping it up and tipping it back and helping it to be slow, you would start to burp in between.